Hi, welcome back to Rohrich Knows Podcast, helping you become a better you. So what am I doing wearing this mask? What's all the rage about red light therapy? It's being promoted in the treatment of some common skin conditions. It also helps to improve or reduce wrinkles, fine lines, age spots, skin texture. Does it work? Well, these are all new devices that honestly have soft science. That means that it's an evolving science. Now, is it something that may have some applicability? I think the science is evolving. And does red light really, improve skin texture, tighten skin? It may work. It may stimulate collagen. It may give the skin a little more structure, more strength and elasticity. And it may even increase fibroblast production. And there's been some early data to show that it may do that in some blinded studies. But it's something that I think should be considered. It's a non-invasive therapeutic method for using low-level red light. And it's got a lot of different potential benefits, from pain reduction. I certainly have actually used it for muscle strain and muscle aches as a plastic surgeon. I sometimes, when I go home and I'll say, wow, my low back really has strained, and I will use a red light for that in the evening. And it does diminish that discomfort, because it's actually been shown to reduce inflammation and accelerate microscopic wound healing. So I think there is a lot of different things that it has on the horizon that I think that are quite beneficial. And of course, red light therapy is very safe. Certainly if you use it along the safety guidelines, 15, 20 minutes at a time, I think you can really, get some potential positive effects to it. You can get some discomfort with it if you actually use it in a more prolonged fashion. Burns are pretty rare, especially if you use an approved device. And obviously eye protection is important. So you really don't want to have prolonged red light therapy, without some eye protection. And of course, before you obviously do it and use it, especially if you're pregnant or have any other health concerns, please consult your practitioner. I think that's very important to do. But I think there's a lot of potential benefits. And how does it differ? Red light therapy is obviously primarily absorbed in your skin, and it's used to potentially increase collagen production. But near infrared light therapy is a little different. That goes a little deeper. That penetrates into your body and it's into the muscles, and it reduces joint pain. So that's a little deeper, and it's a different topic. So red light therapy is a little more superficial. And it's for skin health, some early muscle recovery, very superficial. So I think it does have some potential positivity. And some people even think that it may improve your mental clarity. I'm not so sure about that. And also for relaxation and even sleep. So I think that, the science has been evolving, that it does enhance collagen production, and it potentially will reduce wrinkles and some age spots. And if used in a prolonged manner, once or twice a day, and certainly, and if you do that in a prolonged manner, all these things are things that have to be done sequentially over weeks to months. And I think the biggest potential benefit is that it's minimal to non-invasive. It really does, it does have some positive effects. So it's really minimal to no downside. So I think red light therapy is actually a good, useful, non-invasive way to actually not only to enhance or make your skin look smoother and with potential less wrinkles, but also it does help you in allowing you to, at least when I've been using it, it helps me relax and gives me, I think, a certain glow that actually I haven't seen before. And I've used it now for several weeks, but I must say that I've used it a lot more often in my back, and it has been truly a game changer in that area for the use in muscle pain. So I think it's something that you should consider using. I'm not I'm going to give you a follow-up in several months when there's better and more improved science, because there's all kinds of things that have been touted of reversing skin aging, which I don't think it does. Does it increase your energy level? I'm not so sure about. Improved joint health and better sleep. Well, those are all proposed benefits of true red light therapy, but that's a science that's in evolution. So know before you go. So my parting thoughts on red light therapy is, I think it's an evolving technology that is relatively safe, and it has science that is evolving, and I think it's something you can try. And I would do it like I have. I've tried it first in my lower back, and it's really been amazing in minimizing my musculoskeletal discomfort in this area. So give me your comments, give me your thoughts, and I'll be giving you a follow-up on an ongoing podcast as I use this technology more and more, especially in the face and in other areas. And give me your thoughts on how you think it's helped you in your daily journey to feeling better and looking better. Thank you so much.